Right, good afternoon. Sorry, I've got my printers still going with the agenda. Right, good afternoon. Welcome this afternoon to the Audit and Performance Committee of Perth and Kinross Integration Joint Board. Can I have any apologies, Phil?
No apologies received.
Okay, thank you for that. Declarations of interest. Members are reminded of their obligation to declare any financial or non-financial interest which they may have on any item in this agenda in accordance with Perth and Kinross Joint Board of Governance Code of Conduct. Sorry, is there any declarations of interest today? Oh, I'll take that silence as agreement. Okay, this meeting is really a one-off meeting around the annual accounts. So we'll start off with the governance assurance section. We'll start off with the internal audit progress report, please, by the Chief Internal Auditor.
Thank you, Chair. The report in front of you details the progress report for the internal audit for the IJB's Audit and Performance Committee. You'll note that the premises and property audit is in progress. I'm informed that we should have a draft report by December and therefore be able to consider this report at this committee in March. You'll also note that the consultancy work, which was concluded earlier this year, was commented upon in June, with the final assignment being the commission services, which has been carried forward to the current financial year's audit and will be considered later in the agenda. I'm happy to take any comments or questions.
Okay, thank you very much, Jackie. Any questions, any points of clarity for Jackie? Nope. Okay, thank you very much, Jackie. Here, that's moving on quite nicely. Okay, then there's no points. We're happy with that. We'll move on to the internal audit strategy and plan. That's a report by the Chief Internal Auditor. Jackie, here are we again.
Thank you, Chair. The report in front of you highlights the internal audit plan for the Audit and Performance Committee of the IJB. The public sector internal audit standards require that an annual plan, that a plan for up to 12 months is presented, and this plan fulfills that requirement. Resources are allocated for the internal audit service from both Perth and Kinross Council and also from NHS Tayside through the internal audit consortium there. We have 40 days allocated from each partner to undertake this service. As you can see in section 3, there are 3 items which we're proposing to take forward for the rest of the year. Those 3 are, as I've mentioned just earlier, just a few moments ago, the sustainability of commission service providers, which has been carried forward from last year. An audit on workforce, both of which are very clearly related to the risk strategies that you've seen over the last few months. Final assignment is on the joint equipment loan store, which helps provide support for people to stay or return to their own homes, which obviously feeds into is a control in place for some of the risks within the IJB's risk register. So those are the three that have been highlighted for review this year. And it is very much of a risk-based plan based on previous coverage that we've undertaken as an internal audit service around the key risks. We can't cover all key risks in 1 year, but we hope to do so over a period of 5 years. I'm happy to take any comments or questions.
Thank you, Jackie. I think the question I would want to sort of put to the committee for assurance is there any priority if there's something that you have to due to staffing shortages or any issues, is there some priority you would put to those 3 audit programmes?
Thank you for the question. I'm happy to be guided by the committee and by officers as to which would be their preference, but also taking account of resources availability within the services as well.
Are there any thoughts from members of the committee on prioritisation of those 3? Sheila?
Thank you, Chair. Can you hear me okay?
Yes.
Good. I think that probably the one that would have the biggest impact to the people that we support out in the communities would be the sustainability of the commission service providers, I think.
Okay.
So, and I have a separate question as well, if I may.
Yes, go ahead while you're on.
Thank you. The joint equipment loan store, I'm just wondering if part of that review would include the efficiency in having items returned when they're no longer needed.
Okay, who'd be best to pick that one up?
I can take that one forward.
Okay,
it is certainly my it is certainly my intention to include that within the scope.
I think that would be really helpful. Yes. So I think my own view is that the service does quite a good job getting things out to equipment out to people, but I'm unsighted as to whether or not there's the same degree of efficiency, or even if there's the joined upness, so that they would know when items are due to be returned. And that's probably needs something to. It's probably to link in with the NHS. Your NHS colleagues who would how do they notify the loan service that equipment is no longer required, for example, or the occupational therapy teams. So I think that's something that I would quite like to see included in the scope of that particular review.
Yeah, I think you're right, Sheila. And one of the things that we need to be acutely aware of is the delayed discharge agenda, and people getting back out of hospital, and sometimes they're going to need the equipment. The last thing you want to do is block people because we don't have the right equipment to support them in their home.
Yeah,
Evelyn,
I agree. No, but I think from a finance and audit point of view, or performance, getting the equipment back when it's no longer needed is just as important, I think, because apart from there being a cost, there's also the availability, as you rightly said, of equipment. So I think the scope needs to look at the full 360-degree activity.
Yeah. Okay.
Thank you.
David, do you want to come in?
Yeah, I agree with Sheila that the providers should be the top priority. I'd also like to comment that it's a very clear report, and it sets out very clearly what they're intending to do over the next year. So thank you for that, Jackie.
Okay. Any other thoughts, opinions, comments?
Beth, it's Evelyn here. I mean,
Yes,
I think we do monitor the numbers of pieces of equipment we get back. So I think that information should be available, and people will be given instruction when the equipment has been issued as to how to return it. However, if somebody's had a piece of equipment for a long time, then there's an issue there about, maintaining that ability to get it returned. Yeah. So, but yeah, happy to. I think that would be a good thing to put in the scope of the audit.
Okay. Martin, you've got a question?
Thanks, Chair. And it's really, to look at the workforce, then the sustainability. I'm not sure if sustainability comes before workforce. And so I would be looking probably at the assurance over the management of the workforce planning risks before I would see that as a sort of priority. Because you may review the sustainability service providers and not got any workforce.
Okay, thanks for that, Martin. Jackie, you want to come in? Jackie Paper?
Yeah, thank you very much, Chair. We're just the two Jackies were
I know.
conferring to see which one it was. I was just going to pick up on the Joint Equipment Loan Store audit and just reminding the Audit and Performance Committee that Perth and Kinross Council took a decision to waive the fees associated with the delivery of equipment at the start of this financial year. So it would be helpful to have some insight into the impact of some of that decision making as well, because it may be something that the council's interested in terms of this report as well, Jackie.
Jackie, do you want to come back on that?
I'll certainly look at bringing something like into the scope, which would pick up on that as well. Thank you.
Okay, Sandy, sorry, you feel you're anonymous. I can't actually see you on my screen, but I see you there. So would you like to come in and comment?
I am here. Yeah, I don't know if anybody can see or hear me. I agree with Martin that workforce should be a priority. We talk about workforce all the time, and difficulties in recruitment and retention impact significantly on service delivery. So I do feel that should be a priority.
Yeah, I would just add that when we look at what we're looking at auditing, it's assurance over the management of the workforce planning risks. So we're not trying to review the whole of the workforce planning, but the risks element to make sure we're managing that risk. So yeah, I agree. It's bringing the priority areas up to the fore. Any other thoughts? Okay, so I think what we're coming out of the commissions, they're all very important. But I think what we're seeing is the workforce and sustainability of commission services seem to be coming out from the group as a priority. The joint equipment loan store is something that's a bit more operationally able to commence, Jackie. So we're really seeing that all of them are important. But I think if you could look at your availability of workforce to go to the different areas, and give us some assurance that we'll get these within this financial year. That'd be helpful. Okay, we're asked to approve the internal audit strategy plan for 23-24. Can we approve it?
Agreed.
Agreed. Okay.
Agreed.
Thank you very much. Okay, we're now moving from the internal audit onto the audited annual accounts. And from this section of the agenda, I'm going to hand over to Donna. Please, Donna.
Thank you, Chair, and good afternoon, everyone. This report provides assurance to the IGB of the effectiveness of the governance arrangements within Perth and Kinross Council, NHS Tayside and the two Tayside IGBs during 22-23. The committee is asked to note that assurance has been received on the effectiveness of governance arrangements in the NHS Tayside and Angus IGB, and NHS Tayside has shared their 22-23 annual governance statement as the vehicle for providing assurance. Formal correspondence regarding assurance has been received from the chair of Angus IGB's audit committee, and this is attached to this report. For Dundee IGB and Perth and Kinross Council, their accounts are not yet concluded, but assurance can be placed upon the adequacy and effectiveness of their governance arrangements through their internal audit reports. We do expect to receive formal assurance for both Dundee IGB and Perth and Kinross Council following their committees in December, and a verbal update will be provided to this committee at our December meeting. I'm happy to take any questions before we move to asking the committee to note the recommendations.
Okay, any questions, points of clarity, comments?
Yeah,
Nope.
it all seems really
Oh.
clear and easy. So
Okay, Thank you, David. So it's recommended that the Audit and Performance Committee note the assurance that has been received around the effectiveness of governance arrangements in NHS Tayside and Angus IGB, and also to note that assurance of effective government arrangements in Dundee IGB and Perth and Kinross Council is expected by the end of the calendar year. Are we all happy with that? Yep. Okay, thank you, Donna. Will you take us on to the annual accounts?
Thank you. I'm very pleased to present for approval today the IGB's audited annual accounts for the period of 22-23, and I would quite like to thank the Audit Scotland team, particularly Maggie Bruce and Mary O'Connor, who I'm hoping are both on the call, and I'd like to thank them for their professionalism and their patience at our first audit with them. It has been very much a team effort in the Health and Social Care Partnership, and I would like to thank the Health and Social Care Finance team, which has been led by Mark Grant and Callum Malsmeyer, and also to thank Phil Gerard and Chris Jolly for all their work that has gone into the preparation and production of these accounts. So it's much appreciated. I would like to hand over to Audit Scotland as they will now present the annual audit report, but just before doing so I would like to add that it's noted in the report there is a recommendation for us to conduct a best value self-assessment, and as noted in the report we will endeavour to do this and plan to present this to the Audit and Performance Committee at its meeting in March 2024. But I'd be happy to hand over to Brian, the Audit Director for Audit Scotland, if I can. Thank you.
Thank you, Brian.
Thank you very much. Good afternoon, everyone. It's good to be with you. As touched on, I'm joined by Maggie Bruce, Senior Audit Manager, who'll help me out if there are any really difficult questions. Our audit report is on page 31, obviously, of your papers. Just before I cover the key messages in the annual audit report, I just want to cover a few process things. The first thing to say is the audit's complete. The second thing is just to talk about part of the process. As part of the process of finalising accounts, we're required as auditors just to check in with those responsible for governance, the committee, whether there are any issues they want to bring to our attention, whether that's fraud issues, events that have happened since the accounts 31st of March, or any legal non-compliance issues. So that's just to mention that in case there's anything along those lines, and just to members can do so as part of the questions and following the presentation. The other thing to say is the accounts after this meeting, subject to approval, will be signed electronically by officers, the chair and myself. Moving on to the actual report on page 31, there's an unmodified or clean audit certificate on the accounts. The accounts show an in-year deficit of 16 million. That's after spend from reserves of 20 million, which includes COVID spend of around 15 million within that 20. We cover that at paragraph 24 in the report. Paragraph 34, we just talk about the forward financial planning. For 23-24, there are savings of 3.6 million and reserves are going to be used again 7.1 million. So there's a 10.7 million pound draw in reserves and savings plans to enable a balanced financial budget for 23-24, the current year. In the following paragraph, we talk about the forward plans, financial plans for the next 2 years. We've actually got the years wrong in this paragraph. We'll correct that. It should relate to 24-25 and 25-26, which notes the fact there are financial gaps of £1 million and £1.5 million in those years. The only thing I want to say really is paragraph 42, just about noting the workforce challenges. I think that's an increasingly a consistent issue across integration joint boards, but also actually across all the public sector employers. We note the development of the workforce plan and the reporting of good progress, but continuing challenges, and also the discussion earlier about the internal audit plan and the importance of workforce planning to the integration joint board. So I'm happy to take questions from the rest of the report. Just to say thank you very much to officers and the committee for their patience and understanding. We're still in the process somewhat of catching up from COVID, and that's meant awkward prioritisations, I would say, in terms of our audit clients this year. So just to say thank you very much to them for their forbearance. I'm happy to take questions, Chair.
Thank you, Brian. That's very welcome. Any questions, comments on the annual accounts? Sheila, and then David.
Thank you, and thank you for the report. It's very clearly laid out. I have a couple of questions. One is around the climate change arrangements, and it said obviously it's the responsibility of partner bodies. However, we do have a number of staff, including commissioned services, and I'm just wondering if we have any obligations under the climate change provisions to ensure that, for example, services are delivered in a way that are environmentally friendly in terms of public transport, etc., etc. So I'm not 100% convinced it's entirely the responsibility of the partner organisations to deliver to the climate change targets entirely. So that's more a comment and an observation, not necessarily a critique of the report, but I think it's something to maybe think about going forward. And linked on to that, because we do work with partner organisations, I'm just wondering how does risks that may, and we do some work on behalf of all of the IGBs, for example, there's a lead IGB for or health and social care partnerships for different aspects of the programme of work. But how do we ensure that if there are risks associated with any of those, either financial or operational, that they're captured? Thank you.
If I may, the first part of that is it's probably worth giving a bit of background as to why we have a paragraph about climate change arrangements in the report. The report is addressed not just to yourself as committee members and the Integration Joint Board, it's also addressed to the Auditor General. We were required by our planning guidance from the Auditor General this year to comment on climate change proposals and position and planning within each of the public sector bodies. So that's why the paragraph's in there. And you make a good point, I think, that for the majority of services delivered either by NHS Tayside or by Perth and Kinross Council, or indeed by the other agency arrangements with the other bodies involved in the area, that there really are arrangements in place for those public sector bodies that we rely on. But, you know, if you are commissioning services directly from providers, then you maybe have a point that there is something to do in that area. It's probably worth having a look at going forward. But I think in the scheme of things, and from an audit perspective, always keen on materiality, the significant proportion of services are commissioned from those other bodies we've mentioned. In terms of
yeah, I do accept that. That's why I said it was more a commentary rather than a critique.
But I get the point. There's a remainder there which we haven't really dealt off with, but it was really to satisfy our requirements under our planning guidance from the Auditor General, really, that's in there. The partner organisations and the lead roles and how risks, we haven't really looked at that in any detail. We do look at the various managed arrangements and get assurances from the other auditors, from the other IGBs, whether managed by them. I think that's probably a thing actually for you to think about probably internally, about whether there are any significant risks in those managed services and whether you have responsibility or not. It can have an impact on how these things are accounted for, depending on the extent to which they are managed fully, or whether any risks are borne financially by other participants. So it's probably a good point.
I probably should declare I also raise it at the NHS Tayside Board Audit and Performance Committee. So I just think there's a lot of things that go on within each of the individual health and social care partnerships and at NHS Tayside level, and probably at Perth and Kinross Council level. But there are interdependencies, like I said, either operational or financially. So you know, it's just a concern that I have that these types of things aren't necessarily, there doesn't seem to be an easy mechanism to ensure that if there's anything that potentially puts our health and social care partnership at risk here, that if something's happening somewhere else, that we automatically are aware of it, or very quickly aware of it. So it's just a slight concern I have on that regard. Thank you.
Thank you, Sheila.
Sorry,
Sorry, Brian.
I was just going to say, if I may, it's a difficult it's difficult judgment because of the rather circular nature of IGB assurances. I think there is a danger of sometimes going too far in terms of those crossing over as assurances. We feel that as well as auditors, because we obviously have to rely on the host partners for accounting information, which is consolidated into the IGB. But we also have to think about the IGB assurances to for group reasons back to back to Perth and Kinross Council, for example. So I think there's a danger that it can become too circular in terms of assurances passing amongst them. But I think if there's a key risk which you're aware of and you think should be managed, then maybe it may be something that should be reflected in your own risk register.
I can just come back in again, convener. I think my concern is that a partner may make an arbitrary decision to say actually that risk resides with that health and social care partnership, and therefore it's not being tracked, but it might have a knock-on effect. So the primary risk holder or owner might be a specific health and social care partnership, but the consequences of that risk not perhaps being managed effectively well enough or coming to a critical point is invisible to the other partners. It's that type of, so I agree with you totally about circularity. You could go around and you could make it far too complicated, and it doesn't need to be. But I just think there is a concern I have anyway on a general basis on how risk overall is understood by the other partner organisations and how it may impact them. Probably not for today, but it's certainly something to maybe think about going forward and how we capture some of that. Thank you, convener.
I'm going to bring Donna in. If Donna, is your comment about this topic?
It is, Beth, thank you. I
Right.
was just for members to note that in our strategic risk register, we do have viability of external providers as a strategic risk that we assess at each of our committees. So just to give you that assurance, it is there to be captured.
Yeah, it's less to do with external providers, it's more to do with internal partners, where my concern is. But nevertheless, it's not. We can pick it up another time, Donna, and pursue it perhaps a bit more fully when we have more time. Thank you.
Okay. Move on to Councillor David Illingworth, please.
Thank you, Chair. Can I just comment that the Chair's earrings, Halloween earrings, are very nice.
Thank you so much. It's my son's birthday, so we're having a Halloween party.
And ask Brian if he has any concerns of any sort about the management of the IJB from the audit.
The easy answer is no, I don't. And actually, the audit was fairly straightforward. It came down to it. We have to wait until the work is done in terms of Perth and Kinross Council and NHS Tayside to such a stage that we can take assurance from them, because that's where the majority of the systems process transactions. But there were no concerns in terms of, there were very few changes made to the accounts actually, and there's no significant financial changes made to the accounts. So I don't have any concerns at all, no. I mean, I guess there's the opportunity for the committee members and auditors to meet separately together to discuss that if there is anything that the members want to raise with us.
Is there any follow-up to that?
Well, I was absolutely sure that would be the answer we would get, so thank you.
Thank you.
Just testing me.
Martin, have you got a comment?
Yeah, thanks, Chair. I was getting a wee bit lost there with external partner, internal partners who are responsible for their risk. They're involved. It's no IGB's a role to be involved in their risk, because IGB actually directs. And so I think that would become quite confusing.
Okay, thank you for that comment, Martin. Anyone else want to come in? Nope. Okay then, the recommendations are that we note the contents of Audit Scotland's annual report to Perth and Kinross IGB and the Controller of Audit on the 22-23 audit. We approve the audited annual accounts for 22-23, and we also approve the letter of representation for signature by the Interim Chief Finance Officer. Are we happy to approve those?
Yes.
Yes.
Agreed.
Yes.
Good stuff. Well, thank you, everybody. I think that brings us to the end of our agenda, unless we wish to have any private discussion with the auditors. David, you're not wanting a private concerns about management of the IJB, I hope, are you?
I'm happy, thank you. Thank you, Beth.
Okay, thank you. Well, thank you very much, everybody, for attending this one agenda item, really, the annual accounts and the audit. So we've got the date of the next meetings from December to February 2005. So the next meeting of this group is Monday, the 11th of December 2023. And again, I'm assuming it'll be a hybrid meeting, and I will definitely be in the chambers that day. Okay, can I thank everybody for your attendance and look forward to seeing you when I see you next time.
Thank you, everyone. Bye.
Okay, thank
Thank
you.
you.
Thank you,
Bye-bye.
Chair.